Today, we're here to talk about why hospitals don't want your elderly parents. Had a few caregivers this week contact me about hospitals discharging parents to nursing homes discharging parents back to hospitals, hospitals not wanting to admit the elderly. Do you ever wonder why this happens? I'm Pamela D. Wilson. My website is PamelaDWilson.com. There you can find helpful information for caregivers and aging adults, my caregiving library videos, and the Caring Generation radio show every Wednesday night. In this video post, there is a link to an article called Patients Dumped by Hospital Emergency Rooms. Why does that happen? It happens for a couple of reasons, and let's go through a scenario. Your elderly parent turns, falls, breaks a hip. Now what? They go to the hospital emergency room. The hospital decides whether they are going to get a full hip replacement or a pin. That depends on their current level of physical activity and their physical activity before that fall. If someone was pretty immobile or inactive before the fall, the doctors may only place a pin, because after the fact, they're not going to be more mobile or more active. Where, on the other hand, if your parent walked 2 miles a day, was very active before the hip fracture, they will likely get a full hip replacement. Hip replacement happens, they then normally go to a nursing home for rehab. But what if your elderly parent has dementia or some type of other cognitive issue, and all of a sudden they become aggressive, angry, combative, they don't want to participate? Guess what? The nursing home isn't going to want your elderly parent, and neither is the hospital. When this happens, family caregivers many times don't know what to do. It's a difficult situation because nobody, the hospital nor the nursing home, wants your elderly parent, and more than likely your elderly parent isn't in a condition where they can come home and you can care for them. The battle then becomes the hospital or the nursing home forcing you to stay with your parent 24/7, or hiring a sitter at $20+ an hour to sit with your elderly parent to make sure that they don't get up out of bed. But what happens if they're aggressive, if they're hitting, kicking, biting, combative? The option then is medications to calm them down. But the problem is hospitals and nursing homes are hesitant to give those type of medications to elderly parents because of the risks. There's a radio show that I did a few weeks back with Dr. Neha Jain. It's called Medications in the Elderly. If you listen to that radio show, there is a lot of helpful information there about talking to doctors about medications that they may not want to prescribe for the elderly. You need an expert, you need a geriatrician or a pharmacist, someone who is very skilled with those medications, because other providers won't want to prescribe or they won't want to take the risk. You as a family member have a choice. But then you have the nursing home issue. Nursing homes have regulations where they don't want to artificially restrain an older adult by giving them a medication that could cause a fall. So there's all kinds of legalities here with no one wanting to take any responsibility. You as the family caregiver, the power of attorney, the guardian, it's up to you to navigate these situations, which can be very, very difficult. Check out the article in this video post. Listen to the Caring Generation radio show called Managing Medications for Elderly Parents. Helpful information is there. Have a fabulous day today. I'll see you tomorrow in another video.